Welcome back to Great Day, Colorado. You know, open enrollment season is here, and finding the right health plan, it can be so confusing, overwhelming, but Elevate Health Plans by Denver Health Medical Plan has you covered.
They offer cost-effective, comprehensive coverage that includes everything from urgent care to prescriptions. In this sponsored segment, we're joined by Alicia Persich from Denver Health Medical Plan. Welcome in.
Hey, thanks for having me.
Absolutely. Very important stuff, by the way, so people need to listen up. What is the exchange? When is the exchange open enrollment period, and who is eligible to enroll? We were talking before. Yep. One ends tomorrow.
Well, you know, a lot of people who have employer plans, their open enrollment is going on right now with your companies. So, you know, make sure you're enrolling every year with your companies for your insurance.
And if you don't, when do you have?
Yeah, so on the exchange, which is the Affordable Care Act, and that's what Elevate Health Plans is, we start open enrollment November 1st and we go through January 15th. Open enrollment is typically for those people who don't have an employer offered health plan or they don't qualify to be on a government plan.
Well, let's talk about some of the benefits from Elevate Health. What type of benefits do you offer?
Right. We offer everything from your preventative care is covered every single year, your annual exams, your annual wellness things. We have unlimited mental health coverage. We have virtual options for telemedicine as well as virtual physical therapy for people who are experiencing chronic pain, low prescription costs, and so much more.
So tell us, where can people go to receive this care?
Yeah, so right now, the people who are on Elevate Health Plans who enroll in an Elevate Exchange or a Colorado Option plan can go to the Denver Health Network. We also have expanded our provider network in recent years to include Common Spirit and various other smaller clinics around the Denver metro area.
Now let's get down to business. Let's talk about the copays, the premiums. That's what people are wondering.
Yeah, copays on the plans are very low. Once you actually select the plan that you want, you know, you design your plan. So we encourage people to go to Connect for Health Colorado or to our website, denverhealthmedicalplan.org. To find the plan that really works for them. Some people may want to pay a slightly higher premium for lower out-of-pocket costs, lower deductibles. Some people may want to pay a higher premium for those lower cost sharers. So it depends on kind of where you're at financially and what kind of coverage you're wanting.
Do you cater to people specifically, because you mentioned prescriptions and different things like that, or do you cater to families as well? Individuals and families can sign up for the Elevate Health Plans on the exchange. So again, it kind of just depends on where you are at with how much health care you may need. So, you know, if you're somebody who doesn't really go to the doctor very often and you're just needing that kind of basic plan for emergency coverage, there's a plan for that. If you're someone who has a family that may need a little bit more frequent health care options, there's also a plan for that.
Excellent. Is there anything else you want our viewers to know? Because I know it can be overwhelming sometimes when you're trying to choose what kind of health plan for you. Especially
right now. There's a lot going on in the world right now, so do your research. Make sure that you know you're finding that plan that fits you and your family. And then also something I want people to know is that we don't just have coverage in Denver. It's not just a Denver Health plan. We are in Denver, Adams, Jefferson, Arapahoe County. We also expanded to Northern Colorado with partners at Banner Health, so people can go there. And then we have coverage in the Southwest region and in some mountain counties. So there are people all over the state that can take advantage of an affordable plan on the exchange.
And if you have a current health plan, can you convert over to your health plan? Is that how it works?
If you're covered by an employer, you would want to stick with your employer
but I'm saying, like, if you're self-employed. Oh,
if you're self-employed, this is the time. Good. Yeah, and this is a great plan for entrepreneurs, the people who are self-employed who maybe don't have, you know, coverage through their company. We have something called an ICHRA. Don't ask me what that stands for on this spot right now, but small businesses who want to offer insurance to their staff that's affordable and pay maybe just a portion of those premiums can encourage their employees to select a plan on the exchange, and then they can help cover that for their staff as a benefit. But to answer your question, yes, this is the only time of the year between November 1st and January 15th for someone who maybe was on one plan, taking a look at whether or not they are going to get what they want from that plan, can switch over to a different one on the exchange.
Good stuff. Yeah. And very important too.
Yeah. Very important.
We'll be talking at the commercial break.
Okay.
Open enrollment is happening now. Elevate Health Plans has options for individuals and families looking for cost-effective, quality health insurance for those who might not get coverage through their employer, who might be self-employed and need to get covered. Enroll by December 15th to get coverage starting in January. To learn more, visit their website, elevatehealthplans.org.